Over the past decade or so, there's been a growing awareness of the lymphatic system and lymphedema. And with that, compression therapy has evolved. Today, compression garments aren't just about function. They've evolved in form, effectiveness, and even fashion, giving people with lymphedema more choices and tools than ever before. Hi, everyone. My name is Kathy. I'm a registered nurse, registered massage therapist, and certified lymphedema therapist. And I'm here to help you better understand your compression options. My goal is to give you tools that fit into your everyday life so you can manage lymphedema with more ease, confidence, and control. So make yourself comfortable and let's get started. In this video, we're going to walk through some key information to help you better understand how compression can support your lymphedema care. I'll start by looking at the benefits of compression, not just for swelling, but also for skin health and tissue support. Then, we'll talk about the difference between intensive compression, like what's used during treatment, and maintenance compression, which is part of your day-to-day routine. I'll also show you some tools that are designed specifically for fibrosis management, including specialized inserts and nighttime options. And finally, we'll touch on the emotional side of living with compression, because acceptance and mental well-being are just as important as the physical tools used. Compression offers 3 key benefits, but they don't work in isolation. They're interconnected and build on each other to support long-term tissue health. At the foundation, compression improves blood circulation and lymph flow. When these systems are working well, the body is better able to remove excess fluid and waste from the tissue spaces. The reduction in fluid helps lower inflammation, which is important because inflammation can lead to tissue damage and a loss of immune function in the area. By supporting circulation and reducing inflammation, compression also helps reduce the risk of infections, fibrosis, and fatty tissue buildup that can occur when swelling becomes chronic. And finally, compression helps to maintain or reduce limb size and protects the skin by lowering the risk of fluid leakage and skin breakdown. So while each benefit is important on its own, together they create a powerful protective effect that supports long-term lymphedema care. Compression can be used in 2 different ways depending on your needs. Intensive compression is typically used during the active phase of lymphedema treatment known as CDT. The components used, like multiple layers of short stretch bandages over an undersleeve and foam, or a high compression trimmable Velcro style wrap, are different from what's used in long-term maintenance. They're designed specifically to help reduce limb size and restore optimal shape. During this phase, compression is typically worn 23 hours out of 24, with a short break each day for hygiene and skin inspection. The length of time someone stays in intensive compression depends on their individual goals and how their limb responds, so it's always tailored to the person themselves. Swelling with lymphedema can fluctuate, so your compression needs can change over time. Even if you're in a maintenance phase, there may be times when it's helpful to temporarily switch back to intensive compression. For example, if your self-assessment shows changes in limb size or tissue texture, it's a good time to consider it. You may also use intensive compression after flying or during periods of heat and humidity when swelling tends to increase. One strategy is to wear intensive compression at night while continuing with your maintenance garment during the day, just to help things settle back down. Or you can do an intensive phase of compression before getting a new garment once a year, just to see if there's any fluid that may be removed before you get into your new maintenance garment. If you decide to use the bandaging method for your intensive phase of compression, you have a few options you can consider. Traditionally, foam rolls were used under short stretch bandages, but garment companies have made things easier by producing pre-made shaped foam liners that can be bandaged over top of. These garments have some built-in advantages. First, they are durable and last for many intensive bandaging cycles. Second is their design. Using chipped foam inside the fabric and quilted sewn lines can help soften tissue more effectively than flat foam and help direct lymph flow out of the limb. And lastly, they are easy to use and keep clean. When your limb volume has stabilized after the intensive phase, you will shift to maintenance compression. Maintenance garments are used long-term to help prevent fluid reaccumulating, to maintain the progress you've made in the intensive phase, and to support lymphatic flow on a daily basis. It's important to wear your garment every day so you have consistent support throughout your day. Now, there's a wide range of maintenance compressions available today, including fabric garments that are categorized into flat knit for moderate to severe lymphedema, circular knit for mild lymphedema, and stiffer circular knit for moderate lymphedema. Velcro-style garments are adjustable and can be used during the day or night. There's a wide variety of garments available for all body parts that have swelling, including the fingers, toes, feet, legs, arms, chest, and even the head and neck, depending on your needs. Some people use compression pumps when extra help is needed in addition to their day garment. With today's variety in styles, colors, and fabrics, maintenance compression has come a long way in terms of comfort and wearability, which makes staying consistent much easier. But it's important to know if compression isn't worn regularly, swelling can return. And over time, that fluid buildup can lead to lymphedema progression. Here I'm going into a deeper dive about night compression because for some people, wearing compression just during the day isn't quite enough, and the use of night compression isn't as well known. While we sleep, our muscles are at rest and not actively helping move lymph fluid. And for some people, fluid can start to accumulate again. Night compression helps provide gentle, sustained pressure to support lymphatic flow and prevent overnight swelling. It can also be helpful for people with more stubborn fibrosis or those who need extra support beyond daytime wear. It's important to know that daytime compression garments are not designed to be worn at night. They typically have higher levels of pressure, and when your body is lying down and relaxed, that day garment can actually restrict circulation or create pressure points that could harm your skin or soft tissues. That's why there are specially designed nighttime compression options. Some of these include quilted or foam-lined garments. They're specially designed for nighttime use and provide lower, safer levels of pressure while still managing swelling and helping to soften fibrosis. Velcro-style compression is another option. They are adjustable and can be loosened for night, but still offer support. If you have significant fibrosis or unique limb shaping needs, a certified fitter can help you get a custom garment designed specifically for your nighttime use. Not everyone needs to wear compression at night, but for those who do, it can be a powerful tool for managing progress and waking up with a lighter, more comfortable limb. When lymphedema has been present for a while, the tissues can start to change, becoming thicker, firmer, or more fibrotic. That's where specialized fibrosis products come in. These tools are designed to target hardened or fibrotic areas of tissue and help soften them over time. Fibrosis products work by applying localized pressure to problem areas. This pressure helps break down fibrotic tissue, improve lymphatic drainage, and support better garment fit and effectiveness. There are a few types of products you might see. Chip foam pads are placed under a compression garment to apply extra pressure to dense or fibrotic areas. Textured silicone pads are designed to stimulate lymph flow and help soften thick and hard areas. Textured garments are made specifically to address firming and fibrosed tissues. Many fibrosis products can be worn either during the day with a maintenance garment or at night, when the body is resting and the tissue is more receptive to gentle reshaping. Fibrosis management takes time, but using these tools consistently can make a big difference in comfort, mobility, and the overall effectiveness of your lymphedema care. If you notice thick or bumpy areas in your limb, it's a great idea to talk to your lymphedema therapist or your garment fitter about whether fibrosis tools could help you. It's important to remember that swelling begins to accumulate without the use of compression, so wearing your garment daily from within an hour of rising until bedtime is advised. When you first get your new garment, have a look inside the box it came in for the pamphlet that will explain its use and care. Garments should be snug, firm, and comfortable. If your garment becomes too loose, you should contact your fitter for assessment. If it becomes too tight, you might want to try a cycle of intensive compression or speak with your garment fitter. A backup garment can come in handy when either your garment isn't dry yet after washing or becomes soiled or torn. Check your garment regularly for signs of wear and tear, such as loss of elasticity, thinning, or stretched out fabric. Most garments need to be replaced every 4 to 6 months, depending on its use. To help your garment last longer, wear gloves to put it on. And if you need help, there are several donning and doffing aids available. You can speak with your garment fitter about this if you need to. Lastly, let's take a moment to talk about something that often goes unspoken: how compression can make you feel. It's completely normal to feel frustrated, discouraged, or even self-conscious about wearing a compression garment. Maybe it doesn't fit your style, or you feel like it draws attention. These are very real and valid feelings. For many people, compression can feel like a constant reminder of what they've been through, or a reminder that they're still managing something. It can feel like it's keeping the door open on a chapter you're ready to move past. Acceptance doesn't happen overnight, and it's not a switch you flip. It's more of a process. Some days you'll feel okay with it, and other days it might be a struggle. That's okay. What's important to know is you're not alone in this. So many people navigating lymphedema feel the same way at some point. Talking to a trusted healthcare provider, therapist, or even connecting with others living with lymphedema can help. Give yourself grace. Acceptance is personal, and it will come in your own time, in your own way. Acceptance doesn't mean you love everything about it. It means you're finding peace with what supports your healing. Small goals could mean you wear your compression for short bursts of time. After all, wearing it for 1 more hour today than yesterday is a win. Personalizing your garments could be different for everyone. Some may stick with neutral colors but enjoy a nice pattern sewn into their garment, and others will wear bright colors that match their clothing. It can take time to adjust to your new garment, and talking with others can also help. Give yourself space for acceptance that wearing a compression garment is now a big part of your life. Thank you so much for watching today. Please like, subscribe, and share so others can see this video too. You may want to watch my other videos on lymphedema treatment, management, and self-care that are meant to help you live your best life with lymphedema. I'll see you in the next one.